Ask the Doctor by GPDQ. Expert medical advice for you, your family and your colleagues.
So the countries have been listed and designated in terms of level of risk, basically. So green countries are the safest countries, and amber countries are countries where we are concerned that there may be some risk. And red countries are considered very high risk. They're considered that you're going to run into cases of COVID very frequently if you're doing what tourists do when you go to a country, basically.
Yes, I'm really excited to start traveling again as soon as it's safe. We've done a few staycations.
So there are only two main tests, and I think probably what we're getting at is the variant tests that we are aware of in this country are the lateral flow and the PCR test, and I suspect that this is what we're getting at. They're probably the same names for these two different tests, basically. So lateral flow tests, which many of us are aware of now, are really meant for asymptomatic people. So I won't even call them patients because we're not. So as we know, one of the things that's made this pandemic such a disaster is that many people have carried the virus asymptomatically and then carried it on to people who are very symptomatic when they get it. And the whole point of the lateral flow test is testing in those people who are seemingly well, so people going into work, people going into schools. Our children have had it quite often, to ensure that there's no hidden signs of COVID. And the protocol for that is, if that comes up positive, then it's not a diagnostic thing in itself. Then you have to go and have a PCR test to ensure that you do actually have COVID, and that's the definitive test. So they work in different ways. The lateral flow test is nearly instant, but unfortunately slightly less accurate than the PCR. The PCR remains the gold standard and actually looks for evidence of the virus within the throat and the mouth, which is why it's the definitive test that we're still using for travel.
Okay, yes, that's absolutely great.
So look, FDA testing is pretty much like all of the testing all around the world has been really stringent, and for tests to actually pass those high standards. So what every single country is looking for are levels of accuracy, basically. So they want you to do a test that's going to give you a result which tells you definitively whether you are positive or negative for the virus, basically. And so if something's FDA tested, it will be of the same high standard as it is for the UK, and vice versa. And we haven't come across a situation yet where one of our tests hasn't been accepted around the world, basically. In every single situation, we are carrying out tests which meet the strict criteria that allow people to travel from one place to another.
That's so great. The doctors just told me that the test that I do take that is probably and most likely going to be accepted because of the strict guidelines that it actually holds for the government. So that puts my mind at ease. So it's really great to it's really great to hear that.
So airport testing is still testing. We offer every kind of test in every location, basically. So we have lateral flow and PCR. The testing is carried out by an experienced clinician. So it's a test where we check for the virus in the back of the nose and the back of the throat. So swabs are taken, usually the same swab. We start in the throat and then we move to the nose, and we try and go deep enough into the nasal cavity that we're likely to encounter viral particles, basically. And then the tests are, if they're lateral flow, they're available within half an hour, and the PCR tests are clearly the tests which are sent away. So, but even with those, we say a 48-hour turnaround. It's usually within 24, though.
Oh, wow. Yeah, that's great. That's absolutely great to know.
So we approach each patient as an individual, and that includes, clearly there's special circumstances for children. There's even a whole speciality dedicated to children pediatrics. So we have to adjust the test, and it really isn't one size fits all. So again, this is one of the queries that we've had quite often, for little children, and clearly we are still having to test children who are still preschool age, and we have been doing that up until this stage. And some of the tests are quite upsetting for kids, and we do understand that. And clearly we can't gloss over the fact that kids are affected by COVID-19. It tends to be a lesser illness and sometimes not even present at all. But these are conditions that still need to be met. So what we do is sometimes adjust the test. If a child is very, very upset, I have sometimes actually gone into both nostrils. It's much more superficial sometimes than it is for an adult. And I don't really press it about trying to get the back of the throat. So, I'm sure many of us on here have children. We know how upset they get when they have to just go to a family doctor and have the back of their throat looked at. So imagine then prodding that with a 6-inch stick, basically. It's not much fun. So what we do is we will do it. Some kids are very good with it. We'll do it for those kids who can manage it and who are able to comply. And for those that can't, we will try and adapt it so that we feel we've done our best to get enough of a sample to be representative of whether or not they have an infection.
That's great. I know now that when we come in September, that I can go to the airport, I can get tested, I'll get the results in the same day. And obviously with my son, the approach to it in this situation is going to be a little bit more of an adventure.
So I don't love lateral flow tests. At the moment, we're dealing quite often with parents ringing in with their children saying, I bring them into surgery, please. We've done a lateral flow and it's negative. And we have to explain gently and politely that that probably isn't valid and we have to do a PCR test. So yes, the whole thing about the lateral flow is we do take them as an indicator and they are useful, but no further than that, basically. So I don't see many positive lateral flows. I see quite a lot of lateral flows which are negative, and then we do a PCR and find that that patient actually has got COVID. But any kind of PCR test would have to be followed up. If it was positive, you would always follow, any lateral flow test would have to be followed up if it were positive with a PCR, which then is the definitive answer. There's no messing with that. It will give you a very, very accurate result.
That's fantastic. I know I'm feeling so much more confident about going to the airport. I feel much more confident in that. And maybe I can put all those great practices, in place. And I think especially when you do have children, and I'm so glad that I've come on here with you. So thank you again.
That's great. Lovely to speak to you. Take care.